Dear friends, we are seeing the last chapter on our topic, erectile dysfunction, impotency. We are going to see the last chapter, which is going to be dealing with the treatment modalities. Is it preventable? Can we treat erectile dysfunction? Let's see it in a few slides, which will not be too many. We are going to summarize it and so that we can have a little bit of clarity on this condition, especially on the management, treatment, and preventive measures. So this is a question we are going to answer, which is how is erectile dysfunction treated or prevented? Can we treat it? Is it possible? Is it prevented? Let's go through these slides. We'll be able to answer this question. One, if you have this problem, we saw the details in the previous presentations. This is the fifth one on this topic. So when you see the definition, you see the causes, the predisposing factors, you see the complications. Now it will be easy to understand these treatment modalities. So if you want to understand this well, please check the previous presentations, which is the 3A, B, C, and D. So this is the last one on this topic. Now, if you have this problem of impotence, please, you need to admit. You need to admit in your relationship. Don't be in denial. Say, I don't have it when you have. Admit, that's a starting point. You need to consider physical and psychological health. Check, are you psychologically well? Or there is frustration, anxiety, stress? Are you depressed? Then you need to address those issues. If there is a physical problem, that physical problem needs to be sorted. So when you are not getting erection and you don't perform, you are not able to have sex with your wife. So the treatment is not to go and buy a tablet and drink. No, investigations need to be needed. Investigation need to be done. They are needed. So the problem should be addressed according to the cause, according to the root cause. Then you need to explore the relationship factors that predict the successful treatment. So if the relationship is rocky, is a problem, then the problem is going to be permanent. But if you solve those conflicts, misunderstanding, if you have your wife, you have your husband, you are supposed to live like one person. If you are living like two people in the house, then that's a disaster. This problem will be unavoidable. Erectile dysfunction. So you need to learn about the causes and the treatment. You need just to try to understand what are the causing factors, the predisposing factors. Once you understand them, you will be able to avoid them. Please, if you can go and study the previous courses that we did, especially on hypertension, on diabetes, and the previous presentations will give a clear picture on what could be the underlying causes in details. So you need to discuss with your partner. So you check if there are the problems between you, then you try to solve them so that your sexual needs are satisfied by discussing, by having a dialogue. If these things are not working, you need to seek for medical help. There are doctors who are trained for this. There are professionals, counselors who are trained to help when there is a problem like this. There are non-pharmacological drugs, modalities, treatment that are used without using drugs. The first one, which is highly recommended, is lifestyle modification. Lifestyle modification, we saw in the causes that alcohol is the enemy for the vessels, as well as the smoking. So then it would be better to address these problems. If you address them, you have changed, then things will change as well. Exercises are very good, not only on the muscles, not only on the bones, but also on the heart. and blood vessels. Exercises are very important to whole body. Part of the treatment without using drugs, you need to combine this. You quit smoking, you quit alcohol, do exercises, you eat healthy. That is lifestyle modification. Relationship counseling. So if there is a problem in the relation, the sexual life is a problem, then counseling is very important. There are people who are professional who can help very much, who have experience. The vacuum devices, they can be used, which are not tablets, can be used as well in helping where um, the surgical procedures would be included as well. Sexual counseling is very important, especially when the problem is still minor. It's not complicated, it's not beyond control, or if there is what we call sexual ignorance, you don't know things, you approach people who will help you to know, especially to address these psychological factors. So the pharmacological ones that we are talking about, they are drugs that are used. They are drugs, they are those we take orally. We saw many drugs that are used, we saw some of them, but we can see them again. Oral suppository medication or injections, or those used who are in the urethra where the urine will pass. So these are the different forms of pharmacological agents that can be used. Like this one, phosphodiesterase type 5 inhibitors, Viagra, we do hear about it many times, or sildenafil. But please don't take chances and just go and buy without consultation, because you might be having a problem. For example, you are on a treatment and your treatment is containing nitrate. This can risk to make you fall into hypotension. A severe hypotension can cause coma and death. So hypotension is dangerous because if you don't have blood, then it can be a serious problem. So you just don't take medication without the consultation, without prescription. You've heard about what we call yohimbine, alpha adrenergic blockers, or there is also serotonin antagonists and the uptake inhibitors like trazodone, or testosterone as hormones. The hormones, if you don't have enough hormones, they might give you testosterone to boost your manhood, if I may call it. So if there is testosterone deficiency, it should be provided, but you still need to consult and get treatment after a clear diagnosis. Notably, this medication cannot be used if there is prostate or breast cancer. It's an absolute contraindication because if you get it, you might make things worse. So surgical procedures, we're speaking about implants, where they put implant that would help to stimulate. These advanced techniques that are used to stimulate the penis that was down would be able to erect and go up, or they can do vascular repair. We saw that the vessels have a very positive impact. When the vessels are functioning well, it will help us on the erection, or they can do realignment. So there are surgical procedures that would be used when there is a need by the specialist. So penile implant, they're like a prosthesis. When you change, like when there is a fracture, they put like a dynamic hip screw. They put the screw in the bone, to make the bone healing again, to make you work and walk again. So they put a prosthesis in the penis, especially in what we call corpora cavernosa, the one we saw in the previous presentations, which help on the erection. Or they can do what we call microsurgery. Micro, always when you see micro, it's too small. Macro is big. Micro, on the small vessels, they can do microsurgery. It's done by specialists as well who know what they're doing. And we should never forget that smoking is a problem. Meat consumption. Meat, which has a lot, most of times, bad cholesterol. We need to face the truth. the bad cholesterol will eventually result in damaging vessels. So vegetarianism is something that we should promote. There is nothing wrong. Eating healthy. We know that vegetables, they have a lot of vitamins that help the body to reconstruct, particularly vessels. We know that it has a lot of minerals. We know that there are a lot of proteins. In addition to that, the plants have what we call antioxidants, the product that fight toxins in the body. So it would be much better to go the vegetarian route if you can, but meat consumption over and over, the researchers are showing that it can be a problem if there is no control over this consumption. I think we did cover enough on this topic. The next step would be to ask questions so that we get more clarity. We thank you so much for being with us for this presentation. African Emotion will try the best possible to provide information so that we can change our lives for the better. Together we can. Thank you.